Hey, Assis. Hey.
Bonjour.
Ah, ça va?
Hi, Papa. How are you?
We're good. We're good.
Good morning, George. Good morning, Tony.
George?
Good morning. How you doing, guys?
I'm good. I'm good. Thank you for joining. Yes, cool. That's
Yes.
very good.
Yeah, I'm
Good
just
morning, everybody.
Good morning.
Good morning, Mr. George.
Oh, George, how are you doing?
I'm doing well. How about you?
I'm fine. Hamjambo.
Hatujambo.
Now, in fact, if you did not know, we're going to do the meeting in Swahili.
Uh-oh. Okay.
Yes. The meeting will be very short. Oh, goodness. This is Good morning, everybody, and welcome to the first QHSC, first medical mission, and first summary. Everything is the first. So we are doing this because we just had the medical mission 2021 for 16 days, that including traveling, doing the good work, and then having fun after that. So I'm going to take this opportunity to thank all the volunteers, global volunteers, all the donors, all the corporate sponsors. We had Standard Medical Systems, and then South University, also West Palm Beach campus. And we have Magnet, also supported, Magnet Youth Association, supported also this medical mission in a big way. So we thank you, all those three corporate sponsors. And also, lastly but not least, I thank all the individual donors who came through for us. Every single person who donated, starting from $5 up to $1,000, individual people. So thank you and thank you and thank you. We cannot thank you enough, because without you, 98% of this support for the medical mission came from individual donors. So when we come back next time to ask, even if it's $5, we'll take it. And we thank you for your opportunity and to come and impact the world. And QHSC team, thank you immensely, and we cannot thank you enough. And so our way of thanking you, we compile a lot of information, a lot of work, a lot of pictures, and a lot of memories to come and share with you. To start with, I'm going to thank Mr. Frank Siakabe specifically for capturing all this moment and documenting our journey from the beginning to the end, and carefully and excitingly including everybody on the pictures, and getting those moments that I'm going to share with you today and for the rest of our organization. So thank you very much. And also thank you for helping planning this medical mission. So the team QHSC has worked tirelessly. And of course, we have other responsibilities, but also just having people who are dedicated and wants to contribute their time, talented expertise to this organization. So I thank you very much from the bottom of my heart. And personally, I want to thank my family who received the global volunteer, and they were so happy to see you guys. And we have an extended family now. It does not mean that just only blood related to the family. So we are all global volunteers are also part of our extended family back home, the Gabon family. So thank you very much. And we will continue welcoming you to Tanzania and explore and help the people of Tanzania who need the most help from you guys. Okay, so enough of that. So let's just go and see what did we do. So I have a little presentation here. I'm gonna go through the presentation first and then just touch the highlights. And I know I cannot have enough time to share what we went through. And I know the global volunteers have testimonials to share, but we're gonna go at the end, then we'll let you guys ask questions. And if you have any questions, please use the chat, post the questions there. And I have my co-hosts here, then they will help me If there's something that I need to interrupt and answer that, I'll be happy to. Or otherwise, if we can save all the questions and towards the end, and then we can discuss, and then we have more fluid discussion. So, and I know a couple of people who global volunteer cannot make it today. That's okay because of prior arrangements, but we are going to record this video and summary, and so we can share with everybody else and all the people who supported us. So again, thank you. As I said, today we're going to go give you just a report, what we have done. I mean, how do we start, and then what we have done, and then what can we go, I mean, what are we going to do after this medical mission? Few seconds just to give you an update. I mean, we started talking about the medical mission, or start thinking of even the QHSC a long time ago. So 2016, we started having just a discussion and trying to figure out how did we pay back, or how do we go and contribute to the Tanzanian people. So 2017, 2018, it was an individual mission. I went and did complete the need assessment because we wanted to know what Tanzanian people needs and what can we offer. And then 2018, the same thing, we started doing a couple of things to see logistics stuff that we need to do. And then so we realized that there is no way one person can do this. 2019, we assembled a team of 5 people. So we went and did a pilot mission to see the logistics. If we take people, what are the requirements, what is the expectation, and things that we can help with training and education. So we started planning the first medical mission 2020, but the problem is the pandemic. So that part, we had to postpone that mission. However, we had to host 6 virtual conferences, which was talking about specifically for COVID, training for healthcare workers, and try to share our experiences globally. And then on top of that, we had 2 conferences also with the pediatric population, which is Magnet Youth Association. We were basing, yes, part of it was health-related COVID prevention, and then, but also mostly we was prevention of injuries and try to teach them nutrition value of an athlete. So after that, then the QHSC was start working, and 2021, we planned the first medical mission. And we were fortunate enough to have, when I put 15 plus 4, means 15 on the ground global volunteers and 4 who came, did the virtual consultation and collaboration with the people of Tanzania. So this is the largest group, and I was so excited and nervous at the same time because I wanted to make sure everybody go and meet their goals, like meaning like, okay, if you're planning to go and volunteer, you should be able to get there and volunteer and provide the care that you needed. Okay, so the same way we recruited individuals, how many people do we need? In the beginning, we thought we were going to have only 10. So we posted our recruitment strategies from the beginning of the year, and we were able, as I said, to have 19 people. Again, we give thanks back to South University again for donating quite a bit of medical supplies to help with the training with the healthcare workers. And also we thank Standard Medical also for providing the sponsorship to help with the medical mission strategies and activities. We thank Costco also for helping us to pay some of the shipping. And then, as I said, also individual sponsors. Without your donation, which covers 98% of this medical mission. So thank you again, thank you, and thank you again. Asante sana. And also without forgetting Magnet Youth Soccer Organization, we worked so hard together in helping the kids, and your substantial donations, which helped tremendously on the side of Tanzania to cover some of the costs and expenses that we incurred while we were there. So thank you again, and thank you. So we are planning to work with African Diuno to help with collaboration with tourists and also fundraising from the other part of the Tanzania, but more to come with that adventure. Okay, so when we were planning this medical mission, these are the things that we were thinking of going to do. Teaching neonatal resuscitation, chest compression, postpartum hemorrhage. modify early warning, natural labor techniques. I mean, the list you can see, and we were planning to go and visit in Chuka Primary School, which has 1,600 kids. So there's a lot of kids that we wanted to go and see. We were dedicating the time and resources that we needed for each training to be able to reach at least 1,780 people while we are in the medical mission. So that was our plan. So did we meet it? We find out. Okay, so those global volunteers plans and plan again and get ready to go and engage to the recruitment, engagement on the donations, and our families, first of all, without even forgetting the families of a global volunteer. Thank you, and thank you for letting your family member comes and visit and donating their time, money, and resource, expertise to people of Tanzania. So anyway, so that's the first picture on the top. We, the global volunteer from US team, we were arriving at the Nyerere International Airport. So the suitcases you are seeing, those are the suitcases for all the donation. We have 26 bags of 50 pounds each of donated stuff. So this was beyond my wildest dream. So you can see the second picture that we were sorting up once we get there, because we have to figure out what goes where and what programs needs what. So there's more stuff, and we're going to continue posting in the, our website and the social media to explain and visualize things that were donated for specific programs. So the bottom middle picture, that's you can see Professor Majinge and the matron Elizabeth Kanyenka. So those are the ones who are receiving those donations from Dodoma Christian Medical Center. So again, thank you, thank you, thank you. And all the volunteers that we were helping sorting out, everybody did their part. So thank you again. Okay, so who are those volunteers? I believe you saw them in the video, like it was like 5 minutes before we left to go to the medical mission. So 10 of them were from United States. Okay, so for Tanzanian crew, we then for virtual expertise, we have okay, so what are those volunteers are doing? So we had, we planned purposely to make sure that we are going to represent QHSC, and also we are going to represent the human race, being responsible for others and being taking care of us for what we have, so like paying forward. So on the first few days, we were able to get ready to go and do our routine. You can see we are eating together, praying together, and working together. So that is just meet the QHSC teams there, and everybody's so happy. And then, of course, before meals, we always have Mr. Steve Jones, and thank you very much for your time and your blessing for every event we're doing. Again, thank you and thank you. And I believe wholeheartedly that without those blessings, the mission would have not been successful. So thank you again. And you can see before we start activities at the Dodoma Christian Medical Center, we always have to engage on the praying. So this is happening like 7 o'clock in the morning, every single day we show up there. So thank you for that opportunity to, for Dodoma Christian Medical Center to give us that opportunity to go and pray with you guys. So thank you. Okay, so now we start working, first day. Going around doing rounds, morning rounds with doctors and nurses. So this is always like maybe 5-10 minutes with each patient. So those different, there were 4 groups. So we can see the top right is the pediatric group. So you can see Mr. Katunzi, Mr. Steve there, Mrs. Christine, and Dr. Kabibi, and they were looking at pediatric population. So they were going to the unit and see those patients there. And then bottom left also the same thing, they were coming from out of the room. And then the middle bottom is the OB groups. I was there with Ms. Valentine and Ms. Victoria. And bottom right is Ms. Catherine, Dave, and Dina. They were seeing the patient from medical surgical units and the ICU. So in total, we tallied every single day. We did these rounds and see what type of diagnosis people were there. Majority of them, of course, diabetes and hypertension, infections, and so we're gonna discuss with that more of later in our future posting. And then so also some of the volunteers were fortunate to be able to sit in when the doctors were doing outpatient visits. So just to see what type of the patient comes into the Dodoma Medical Center. So we have also that compilation, and we're gonna share with that when we post this video. So in all, we saw close to 100 patients for all those 8 days that we were in at Dodoma Medical Center. Okay, so what else did we do there? We had to do some training. So we did neonatal resuscitation, we have CPR, and we have newborn with thermoregulation. Just those are some of them. So we had total of 70 healthcare workers, means like the doctors, the physicians. We had medical attendants in there to be able to see how do you resuscitate the baby, how do you help the baby breathe. So we have to do the regular help baby breathe, and also specific neonatal resuscitation for the OB nurses and doctors. And then, of course, for the newborn thermoregulation, then Ms. Valentine and Catherine did an excellent job to help the moms and teach them how to take care of the babies once the baby is born, to make sure the babies maintain their temperature. So thank you again for doing those things. We're going to share more videos of actual training in the future posting. Okay, so what else did we do? We had a virtual conference. One of them was gestational diabetes. And so this conference was attended by 30 global participants, and you can see on the videos we were doing virtually, but in our room we had more people in there. So there was a lot of discussion covering the scenario of gestational diabetes. What protocols do we have? What type of patients should we have? What type of training do we need? That's one area that we have to focus on the second medical mission, because there's a lot of gap there, and compared to what the pregnant woman who is experiencing diabetes during the pregnancy, what type of protocol do they have, and what type of protocol we can train people from Tanzania to be able to learn that. So there's a lot of information coming out of that. Okay, another thing we had, Dr. Gwen, thank you very much for creating the video, and it was able to be shared with the 10 healthcare workers and DCMC, and they had so many questions. So some of the questions I just posted right there. So we have a lot of work to do, Dr. Gwen, so thank you for your time. And I apologize for not being able to connect you to talk to them during the medical mission because of internet and time, because of course of the COVID, it was hard to have the anesthesia department free from the increasing number of surgeries. That week we were there. So, but we're going to continue working with that to make sure they still get your feedback, and we can arrange other times that you can offer those training. So thank you. Okay, so now that was already by weekend now. I think the QHS team needed to at least breathe a little bit. So what did we do? We went with Matron Elizabeth to one of the Lutheran church. So we were able to go and see how the Tanzanian Christian members pray in the church, and it was a very welcoming environment. So thank you very much, Matron, for giving us an opportunity for us to go and see. So I'm going to share this little video. You can see how exciting and blessed we were. Okay, so that was just a synopsis. We're going to have more videos on our future posting. We can hear the whole song. So thank you again, Matthew and Elizabeth. Okay, on the top right, you can see at the end of that Sunday, we went to visit Miss Atwite, and she has winery in Dodoma, and so we were doing wine tasting. So again, more future videos, you see a lot of having too much fun. We learn how to taste wine, and some of us will just drink because we like it, but at least we had a little short course to know what it is. So those are some of the activities that when you're coming to volunteer, you do have some downtime, then you'll be able to go and explore what is offered in Dodoma or the location that we are going to be in. So thank you. Okay, so what did we do now? So then we have Mr. Anthony Goodsmith came and joined us on the medical mission, and he is the CEO, and also he was able to bring the vein eye carry. So this is an instrument that helps, or device help to find the vein for those difficult access, people who are experiencing difficult access. Remember, majority of the people who are compromised, they were the little babies, neonatal patients. So thanks to Mr. Anthony, then he was able to bring this device, and we were able to do some training from the doctors and nurses, and we bring also some of the babies that we, it was a success training to find those veins. And of course, we know it depends on what the type of the patients we have. Sometimes you might not have to access those veins easily, but thanks for those training, and I'm sure the people from Tanzania, Dodoma and Dar es Salaam appreciate your presence, and QHSC, thank you for coming and share this much needed training with people from Dodoma right there. You can see the pictures, and some of them are pictures from Dar es Salaam. Okay, so now the other part which we did, we went to community outreach. So one of the schools that we went to is the Nchuka Primary School. This is one of the schools affiliated to the Dodoma Christian Medical Center. And then so we spent there 5 hours. But also remember, there was 15 of us. So 5 hours multiplied by 15, that means to every child you receive quite a bit of hours. I will show you at the end how many hours we did we total them. We were able to see first grade to sixth grade, because 7th grade they've already finished school. And then so we were able to see at least 1,500 excuse me, sorry, 1,507 children. And then also there was teachers there, so there was 35 of them. So thank you for that opportunity. And we were able to teach hand washing. You can see Valentine and Katunzi showing their techniques and how to use Maji Tiririka to when the kids are washing their hands. And then you can see on the bottom left there, Miss Kristen, Dina, and was in the group. Oh, Lucas, and the head teacher showing those the children who in Awali. So Awali is like a pre-K. So these are the kids that eventually they want to come to be kindergarten, then first grade. So those are the kids that needed to learn about hand washing. In the middle part, you can see Miss Catherine, Miss Victoria, and Miss Maureen teaching dental hygiene. They have those the demonstration for the brushing their teeth. So then the children were repeating or returning demonstration for what they have learned. On the bottom left, sorry, right, is the teachers, and from that Nchuka Primary School. So at the end of the day, we did have surprise for teachers, notebook, pens, and crayons, crafted materials. They were donated for the teachers, and some of them received the backpacks also. Okay, so another part of this visit to Nchuka, we were going to give these kids, to inspire them, to encourage them to do the homework or stay in school and dream big. So one, I want to thank Village to Village Care from Endicott, New York. Dr. Anna Marie, thank you for your leadership and organizing part of the fundraising for this backpack. They donated 100 backpacks with other donations. And then Mrs. Christian Behuniak and Mrs. Kay Holster, thank you very much for all your gathering for the donation to support that mission, which we posted last year. I mean, we sent those supplies last year. Unfortunately, some of them did not make it, but probably half of them made it. But also for this year, also for QHSC first grade, we did raise for first grade drive. We raised to buy those backpacks for those kids also. So in totality, we were able to provide the top 10% of each grade, from 1st grade to the 6th grade, the backpack. And inside the backpack, there were pens, notebook, 2 or 3 notebooks, crayons, all the supplies that the children need to go to school with. So for those 6th grades, total of 234 kids were able to receive those backpacks. So thank you for all the people who donated behind those initiative and fundraising. And thank you, and thank you, and thank you. The kids were so happy to get those backpacks, and now they'll be able to go to school and with their supplies secured. So thank you. Okay, so from that school, now we had to go to another school. So this is before we went. Remember I said before, we are thanking Mr. Steve Jones. Okay, here again, before we start that trip, because we had to go like an hour and 15 minutes from where we were to go to see this, the hospital and the children. So this is what we started our day with.
As we're gathered here, oh God, in your holy, righteous name, we ask you, oh God, to go forth and to do your will today, oh God. Let this trip be successful, oh God. Let us go forth, oh God, and make people happy so they may give you thanks, oh God. And even us, allow us to feel the joy, the compassion, the love that they feel within our heart when we be able to help them, oh God. God, a safe journey there, oh God. I'm asking for a safe journey back, oh God. And let our compassion, let our love support to them, oh God, in a big and mighty way, oh God. Let us be accepted in your service and your sight and be accepted by them and as well. All this we ask in Jesus' name, amen.
Amen. Thank you. Okay, so once we get to Congo, what did we do? We had 2 areas to focus on. At the Congo Hospital, then we did the education and training for the healthcare workers. There were 45 nurses and doctors there. We did postpartum hemorrhage. That's one of the areas that they really requested the help. So we were able to do the training for those healthcare workers. And on the top right, you can see the we had a demonstration asking the attendees how much how much blood is on each pad, and to see how their estimations, how accurate are they. So it was an interesting, as I said, we post more videos of the actual training, and you can see how did we get there and how many people were close to accurate and how many people that they under or overestimate. So that was a very good practice, and a lot of people were excited about that, and we spent an hour and 10 minutes for that training. On the bottom right, we were giving those surprise extra chucks for bleeding, all extra pads for postpartum moms, just to help them with identification and assessment of postpartum hemorrhage. And we had a lot of masks, the face shield for the Congo Hospital. So thank you, Dr. Saras Mutabuzi, so for arranging that, and thank you for the regional medical officer who allow us to get there to be able to go and see these people at the Congo Hospital. Okay, so with that, from Congo Hospital, now we are start going to meet the leadership for TASAF. TASAF is one of the government programs that focus on the at-risk children who needs help. Like I'm talking about just basic things for them to survive. They do need help. So they are children who are identified by the government. And then so thank you very much, Ms. Jessica, for giving us that opportunity to be able to go and join forces with TASAF management. So on the top right, you can see we are going to say hi to leadership, and on the bottom left, you can see we were crossing from one street to the next to go to see another office to go and say hi and introducing ourselves. On the bottom right, we were just collecting our ideas and what exactly we need to go and do with these children. So it was exciting. There's a lot of things that we can do. Okay, so once we arrived to the Congo Primary School, where we had identified 50 children who were at risk, as I said, the children who need help with everything. And then there's also, we identified 50 children with top 5% of those children to be able to receive also some surprise and just inspire them, just give them hope that even if you have a difficult beginning, that the end should not be the same like that. So you can think big and get them out of their like feeling living in the difficult environment, but then they should just hope that one day they're gonna be able to be successful. So we also did the education, hand washing and dental hygiene. You can see our champion global volunteers there, Ms. Dina, Catherine, and Valentine's. And of course, we have more videos of all the global volunteers who are participating one or the other. And then on the bottom right, that's the person with the maroon suit there was the head teacher for that school. And he was giving us a report of what things that they need and what are things that they're lacking at the school, and then presenting it to global members there. So in kind of asking for our help. And we did acknowledge their challenges, and we pray that we'll be able to help as much as we can. And then that's why we come back and ask the good people from America and everywhere in the world to come and help us, so we can go and make a challenge, contribution to these children who are experiencing a lot of challenges that the global volunteer will tell you that is beyond one's imagination. So thank you again. Okay, so while we're at the school at the Congo, again, as I said, we spent almost like 3 hours. So we did do those training, and those are, you can see the volunteers are packing stuff in there, or those backpack. And backpack has quite a bit of things in there. They have the soap, they have the toothbrush, toothpaste, notebook or crayons, pencils. I mean, anything that the school supplies are needed. That's where we did. So thank you, Ms. Victoria. Also, she collected extra backpack from Texas. And thank you for all those people who donated through you to QHSC. And we thank you for your dedication to try and come and help the children at Congress. So again, thank you. And thank you for TASAF management for allowing us even to go and reach those children. So for the schools, those children and the teachers, also the teachers have received a lot of supplies also, like pencils, notebooks, and craft supplies. So when the children need to do or practice anything like that, then they should be able to do that. Okay, so the Dodoma was over now. So was it over for the global mission? No, we're still moving to Mikumi now. So we worked so hard for those 8 days. Now we are boarding the van. Thank you for Mr. Lamek on the right there. You can see he's the one who organized all this medical safari and come and get us from Dodoma, and now he's taking us to National Park to go and see the beauty of the Tanzania can offer. So it was a nice long trip that you can see people are dozing off. Okay, although this picture got people were smiling now. And thank you, Davey and Tony, for entertaining us on our way to our national park. Okay, so on that evening, we were able to go and see the Maasai. Of course, that's one of the nomadic tribes in Tanzania. And you can see people were too excited to a point that they were showing off their skills of driving snakes. Okay, and in the top right, you can see, we were walking from our van to the Maasai land, and then we were able to visit with them, practice starting the fire. It looks very easy, but just you get more videos after you see our global volunteers practicing trying to start the fire. But anyway, it was exciting. Anyway, so then next morning, of course, now we're gonna start seeing the safari. There's so many videos that we're going to be posting. You can see the giraffe, the elephants. So they are so close. You can see them. You can even talk to them.
Yeah, he said, but I'm not moving. This is my best photo. Nice, giraffe.
You can see some of the elephants who are just enjoying the water and playing around, but it's hot. So then their skin get cracks, and then so they always just come and splash their water on themselves. Okay. We were fortunate enough to see the lions, which was a scary thing, exciting but scary.
See how they use the dirt?
So you see the two big ones, and then so coming back, this three, okay. Look that close.
You can see how close we were. So it was a little scary, but just wanted people to come back. Okay, so we started, oops, this is going too fast. So we're back from the Mikumi now to Dar es Salaam. So you can see on the top left there, still people are enjoying the trip and reliving their moments and excitement so far. And then so now on our way to Dar es Salaam, we stopped by to get little, I think buying some souvenirs and stuff. It was just a miracle to a point that one of the child was playing around with the other kids, and that child experienced severe burn. Thank you, Miss Victoria, for her dedication to her profession. She's the burn specialist, and she was able to provide this much needed care for this kid. So you can see the villagers came when we were providing this care. I'm sorry. On the right, you can see that's his mom. She was worried that who are we to come and give care to this child? So we had to explain ourselves. And when she was satisfied, she was able to let us take care of that child.
I think we'll explain some of it more, maybe a little later on. So.
Thank you. Okay, so from there we arrived in Dar es Salaam, and now we are going to Muhimbili now. So there was only a few people who were allowed because of COVID, and we are going to see the neonatal population, so they were not allowed too many people. So only 5 of us were allowed to get in there. So again, thank you, Mr. Pranka, for getting those moments that at least we were walking through all those hallway from Muhimbili National Hospital. And then so we met Mr. Roberts there, and he was explaining about the NICU, what their needs, what they're experiencing, and what we could help or working together to try and address some of the challenges they're facing. One of them that he mentioned is education and training. So, and of course, that's a part of our gold standard for our QHSC is education and training for the healthcare workers. And so this is something that we've been discussing for a while. So we were going to visit this hospital and try to match our expertise with the need they have, and it was a beautiful thing. You're gonna hear from the testimonials from everybody else who was there, that how much help is needed. So you're gonna see also more videos later when we're posting on the social media and stuff. We were able to tour the units and see the babies who really, really need help. So in wards, the children are placed in a ward. So like there's 20 or 25 kids in one room, and they're just lined up one crib after the other. And we saw kids, for example, some of them have gastroschisis. So if you don't know what is gastroschisis, it means like the child is born with some of the part of the intestine is outside. And then so you can see the challenges that comes by sharing a room, by just being there and with some of limited resources. What are these challenges these kids will get? So, I mean, it's so much stuff that it's overwhelming. And so, but just having people who are expert there, it just helps to know what we can contribute. So it's a lot of learning moments. Okay, so we finished Muhimbili and then we came back. The next day we went to meet our the children, the Magnet Youth Soccer Association, and they were, we were fortunate enough to get 100 children, and then parents and coaches, which totaled like 50, so 150 people there, and we spent almost like 5 hours. So we did pediatric screening, and we did pediatric screening. We were checking their heart rate, pulse rate, temperature, blood pressure, their height, and then at the end we were calculating the BMI. The goal for that is just to identify the children at risk. At risk means either they are low their weight, or they are more than what they should be weighing at their age group. So we, as I said, we were able to do screening for 100 children, and then so we are working on those data, and then we're going to give report to the Magnet Youth Soccer Association, because we need to make sure we follow it up. And then part of the training also we did was nutrition and prevention of minor injuries and first aid kit. So thank you, Ms. Valentine's, Ms. Catherine, and Ms. Tamasha for doing those dental hygiene, nutrition, and first aid kit. And thank you for the other volunteers who did the health screening. So it was like an oil machine. Everybody was just doing something else, and we were able to do those 100 children within those 5 hours. So, and then you can see some of the pictures here. Some of the parents were there, and they were very appreciative for what we were doing for their kids. And then bottom left, you can see Mr. Tuntufi Mambusi, who is the CEO and for the Magnet Youth Organization. He was briefing us what is expectation for that day, and what are we supposed to be doing, so we can match for what we can provide care for those kids. And then some more education, more education, more education. Okay, so we plan all this. Remember, I showed the similar slide from the beginning. And so this is what we were able to do for those 16 days, including for every locations. So for the neonatal resuscitation, we were able to see 70 healthcare workers for 1 hour each. So when I put those 70 hours, that means each individual person who attended the end of the training, how many hours did they receive? So when you see those hours that are added there, they were like almost 8,000 hours, 8,833 hours and a half for all the people who attended, who are 2,067, excuse me, 2,067. So all those people receive that education. So if you send one person to go and teach you what we did for those 16 days, when I say 16 days, we're adding 2 days for traveling. So I say 14 days. So if you send one person to go and teach you what exactly we did all those days, that person will spend 368 days to complete what we did for all those many peoples. So it was an eye-opening. So we did a chest compression for 30 healthcare workers. We did postpartum hemorrhage for 45. Magnet used the 150 because children and parents. Natural labor technique, we did for 15 labor and delivery nurses. And then vein eye care, we worked for 2 days. So for both locations and for 3 days, we had at least like 30 healthcare workers whose purposefully was learning to do the stuff. And then hospital rounds, we had like 100 patients. And then for Ntuka was 1507, and for Congo it was 100. So if you add all, sorry, for virtual, so we had 30 healthcare workers. So if you add all those stuff, it was a lot of hours within 14 days. So again, thank you for all the global volunteers for what you did, just even being there. It was appreciated. Okay, so how did we get there? How much was spent? So this is just a scenario, just in case, for example, if somebody was exciting and then tried to give us the money to go and complete what we just finished. When I put cash at hand, it means the global volunteer, 10 of them individually pay for their way and all the activities that they did while they're there. So the amount was close to 14,000. And then so total individual donations, so that was almost 4,078. So this is what that we collected from individual people who gave us through Cash App, GoFundMe, PayPal, Venmo, Zelle. I mean, some of them wrote an actual check, so which was great. And then so corporate sponsors, we had one company gave us 500, the other one gave us 50, and then in-kind donation. So this is people donating actual supplies. So we were trying to figure out, and this is just an estimate because it's hard for people who are collecting stuff and then donating, like maybe a notebook. Some people collected maybe 500 and they're like, I don't know how much it is. Or the people donated, so they don't know what the actual price. So this is just an estimate, but I believe the amount is more than that. And then, but next time we're going to be a little bit more cautious and careful to estimate as people are giving us, so we can have an accurate total number at the end. So one of the corporate sponsors also gave us their contribution was to pay for the donation of the training stuff. So that was almost $600, almost $700. And then so the corporation sponsor and collaborator, so that's part was the magnet, so it gave us a 787. So they said this is just a rough estimate. Remember, the transaction you have to change for the currencies, so sometimes you lose some money there. But all in all, if somebody was supposed to give us money to run the same mission, so we might need at least $25,000. That's just a rough estimate. It may be probably a little bit more than that, but that's just a rough estimate that we have to run the whole the mission. So again, I thank you, every single one of them, starting from somebody who gave us $5 up to somebody who gave us $1,000 at one time. So thank you and thank you and thank you again. We cannot do without you. Okay. So what are we going to do next time? So these are just the ideas, that's things that we need to work on and identify. We are going to be a targeted training. It means we have to identify areas that we need to go and do this training. So one of the perspectives are Muhimbili, of course, and then working on talking about the burn unit, working with the NICU that will be visited, and of course the OB. Of course, if you have a NICU, you are going to worry about the OB also, because those are the moms who are delivering those babies, and you want those moms either to come and breastfeed or mom come and take care of these kids. So having NICU and OB is always connected. And then of course the Malayama Hospital, that's a new perspective, and then for Buguni Health Center also is a new perspective. And then for community outreach, of course, we were in Tuka and Kongwa, and of course now we are trying to find another place, which is we were trying to access one of the group that is still under the government. So we are working with TASA management, and again, thank you, Ms. Jessica, for connecting us. And then of course, things that we are looking for. So if you're going to the Muhimbili hostel, we want to work with the school that is associated with the Muhimbili, because remember, those are the patients also going to come to Muhimbili. So if we can try to provide the education and try to keep that population healthy, hopefully they might not need the service unnecessary. The same thing for Buguruni, but a lot of these things are still in work in progress. But at the end of this year, definitely we have an itemized and confirmed plan to know maybe 3 areas. That's what we're going to focus, because our goal is to make sure if we go to do education and training, how do we sustain it after we leave? Who else is be able to do that? So we have to be focused and diligent for what we do to make sure we meet those expectations. Oops. Okay, so included in those future activities, I mean, as I said, you were still talking about, I'm sure you guys have met Mr. Wilson. He is talking about improved CPAP, which does the NICU population. Remember, we are worried about the NICU at the Muhimbili. So some of the kids need this device to be able to breathe, even just to survive. So we are still in discussion and trying to find out how can we best impact this innovation, and how can we help and make sure it's going to reach the person who require the most, which is our little babies. And then so we're working with Ms. Dina Komakoma with Buguruni Health Center. We are still discussing, they need training with emergency training on neonatal and maternal issues, diabetes versus gestational diabetes, neonatal mortality. And then they're also working usually with the teenagers. So we are trying to see what are logistics. And remember, all these things are discussion. We have to see how many people we can recruit, how many expertise are we getting, and that will determine which hospital we can go. So all those are possible potential. And then so if you find yourself feeling on those area, oh, I'm interested in working with an improved CPAP, and that's your area for expertise, then of course, just get in touch with me, and then we can try to figure it out and see if we get more expertise on that area, and then we can do a bigger impact. Then of course, that's the area that we're going to include in our medical mission. Another one is for another hospital, it's called Malayama Hospital. So this is Dr. Zaverin Benela. And she is requesting, after she heard that we did the postpartum hemorrhage from Congo, and she was really, really interested in for us to go and work with nurses and doctors at the hospitals and try to manage all those obstetric emergencies and preeclampsia, postpartum hemorrhage. We know that she also, of course, need help with anesthesia. So that's where Dr. Gwen, you're coming in. So we really need your expertise there, and any anesthesia personnel who wants to be involved. And of course, neonatal resuscitation is the big thing. So definitely CPR, and we know that. So it's a lot of things. I mean, all I can say, if we these areas touches your expertise, please come and join us. Even if, for example, you're not a healthcare worker, but you're willing to come and spend your time like what we have, this past medical mission, we can still use people who are dedicated, and our sole goal is to go and help people versus doing anything else. Of course, working hard also comes like we have to relax and enjoy and explore Tanzania. That goes without saying. However, the goal should be the spending time and donating our expertise to help these people who otherwise do not have chance in life. And then of course, we still continue working with Dr. Gwen with an ongoing training of operative procedures and content. So the anesthesia part is going to be covered by Dr. Gwen Randall. So she's going to still working with whatever the area that we choose to work on, then she is going to be helping us with those training. Dr. Mkonye, this is for, a pediatrician from Tanzania, but she's in training in South Africa. So she will be coming back, and of course, these are the communication that we are still doing all those training at the Muhimbili. That's why she's in charge there. So still training gestation diabetes, and she was one of the global participants on that virtual training. So, and also she's working with Dr. Msambichaka, and Dr. Msambichaka is going to have a bigger role of organizing some of the physicians and healthcare workers to ask the team, ask the questions, so consultation, which is one of our goals in our QHSC. So we do have exciting things, fundraising. So we have Ms. Nancy Littner, who has been working with us, helping us with corporate sponsors. So thank you, Ms. Nancy, for helping before and continue helping. We have areas for fundraising, including like a pizza day or Facebook, GoFundMe, you guys know those things. And then of course, we are working on grants to be able to try and help pay for those activities that we need to do. And then of course, that will help alleviate expenses for the people who are volunteering. So we want to make sure, if we get the grants, then that at least will reduce the expenses for the volunteers. And of course, we are working with, try to do some research, more news to come. And we had some initial fact finding for this medical mission, but we will share information once the little informal survey was collected, and we collected it and analyzed. We will share that information for future medical mission. After we finish all those parts, then now we have to go and clean up our eyes and enjoy the what Tanzania can offer. That's an Indian Ocean right there. Early in the morning before we left the hotel. So it was fun.
Good morning. Hi, Zanzibar. Bye, Zanzibar.
Good morning. Hi, and bye, Zanzibar.
I know, Catherine, you wanted to stay there, but no, we have to come back and work. We'll go back again. Okay, so to finish up, so then I can open, so for everybody to speak. We were fortunate enough to be able to do all that we did today, during a medical mission. And we are fortunate to have family members, friends, and co-workers, and I mean, anybody who is related to us, trusting us that we can go and do these things. So we had so much fun, and we can do more because you can see the need is there. So this is just one of the activities that if you have a hobby that you did not know you have, so you can come in and explore. Okay, so moving forward, we are ready for 2022, and after the end of this meeting, then we're going to start focusing on 2022. And I welcome anybody who wants to participate in one level or the other. And then you can come and join us, and you can see there's just so many places that you can join us. And special thanks to Mr. Steve Jones and Mr. Dave Latin for doing the data entry and documenting, like the statistic stuff that we did. So we were able even to know how many patients we saw that time because they put those information in the computer. Thank you, and thank you, and thank you. So anybody can join the mission. You don't have to be only the healthcare worker. Okay. So I am going to welcome people to come the testimonials for people who went to the medical mission, trying to share their experiences. And anybody who has question, please, if you, I don't see any question in the chat, or if you want to ask the question right now, that will be fine. Raise your hand. So I will let people start speak now. Karibuni.
I'll speak. Hi, folks.
Oh, hi.
This is Tony. I just want to say this has been an incredible mission, and we're so proud to be a sponsor and a volunteer. It is a life-changing mission, and it won't be the last. It has spirit something in my heart and my soul to dedicate half of my professional life in healthcare to this effort. So this has spirit something that we will not forget, and we will continue. If you would like to have to know that we are planning to raise funds from all of our affiliates and manufacturers that we represent to raise money to donate a vein eye unit at one of the facilities there, either at Dodoma Christian Medical Center or Muhimbili. That's what we are going to be working on now to raise funds so we can get that medical equipment, the vein eye, and then you mentioned the CPAP, improving CPAP. So we have expertise in that, and we will be able to fulfill that part of the next mission. But it's been a dream of mine for many, many years to do work in Africa. And I just thank God and QHSC for having that opportunity to fulfill that goal, and also to touch the lives that we touched in Tanzania. And we will definitely, we won't forget it. And I know it was one of the other highlights was experiencing with the Maasai and the chanting. And also we did make fire, by the way. So when the guy said, he said, no fire, no eat. I had something trickle in my stomach and said, I don't like to, go on a hunger strike, but we got to make this fire. So we were successful with that. And also seeing those poor babies in that neonate unit, you cannot unsee that. So that is something else that will stay with me for the rest of my life, and give me that burning commitment to do everything I can do to raise funds and to volunteer and commit services to help those little babies in those neonate incubators. So that's just a snapshot of what I have. And if you guys need anything, please don't hesitate to contact me or any of the other manufacturer affiliates that we work with through Standard Med.
Thank you very much, Mr. Anthony Goodsmas. It was a privilege to have you on the trip, and as you mentioned, those devices for those little NICU babies, it is heartbreaking to see that a normal device that we use every day here in the United States is so much needed to save hundreds, if not thousands of lives of the children in Tanzania, and they don't even know that. They don't.
Exactly.
Yeah, so it's, I mean, I appreciate and I welcome the offer that we're gonna hold you to that. improve CPAP, and of course the vein eye is needed. It is needed. I mean, when we were trying to start those IV for those little babies, you can see, first of all, they're already compromised. Just being in the NICU baby, they're already compromised. So if we can lessen the trauma, the stress, the pain, even for a little bit, by starting an easier IV access, I mean, that is huge for that child, because it's trauma increased glucose demand, adding body functions, and then the child who is sick already doesn't have the chance to be able to survive those situations. So doing that, it helps quite a bit. And speaking for the NICU, I see Dr. Robert Moshiro. Can you say something, please?
Thank you very much. And on behalf of the Muhimbili National Hospital, I'd like to extend our deep appreciation for you visiting us and see how our working environment is, and you know, bringing, you probably may have noticed, but then we have just to continue to help those that we can help, but obviously with a big room, very big room for improvement, I think, in the future. And then I really like what you are giving back to the Tanzanian babies and children.
No, thank you very much, Mr. Robert. So Mr. Robert is the, Dr. Robert is the one who received us for Muhimbili, and he gave us the tour for the NICU and share with us, as I said, education and training and challenges, lack of resources, or limited resources, I should say, for those babies in the NICU. It is, we were humbled just for your time and explaining those things. And we very much be in touch. And so don't get tired of us, because I'll be like probably texting you more often and try to ask you, what about this? What about that? Can we do that? Can we do this? So I'm sure a lot of people, when they see that, and there's a huge change in heart to help these babies who otherwise they don't have help. So, and thank you again for even letting us, opening the door for us to be able to come and see. And I know the limited time, and so we definitely gonna work together. Definitely.
Can I
Definitely, Harriet. Anytime. I mean, we have to collaborate to continue doing the good work.
Yes.
I was gonna, since we have the good doctor on with us here, I wanted to share a quick little story. It's nothing special or important, but I'm taking pictures there in the NICU. I got this hat on and I'm drenched in sweat. I mean, I'm soaking wet. I take my hat off and I look over. I think Dr. Robert was standing next to me, and the lady starts closing the windows, and I'm like, wait, what are you doing? And she's like, the temperature is dropping. And I'm like, that's when I realized it. So they're regulating the temperature, I guess, with the, with the windows. So yeah, and it was, the windows were open and I was sweating.
Yeah, I mean, there's some is already hot. So, and then of course, being in the environment and having more people there is gonna add, you know, like temperature demand or drop the temperature. And those babies do need those temperature control. And then so like what we did for DCMC, the thermoregulation. So those, remember, thermoregulation for a stable and healthy baby. Now go back to NICU, this baby is compromised already and needs those fancy equipment that we use here, just like, oh, put the baby on the warmer, put the baby on the stabilizer. I mean, we just think twice, turn around and pull it up and plug it in and put the baby in there. At Muhimbili, they do not have that. So what can we do? What can we find to be able to help them, all those babies who were there, and regulate that temperature, because some of them needs to stay nice and warm. So yeah, it was an eye-opening, and I'm sure other people, Valentine, you're here. Can you share something?
Yes, hi. So I find it mind-blowing that something as simple as a little more education and having resources and certain supplies can help to save someone's life and to help to just make certain things more smooth or to prevent certain illnesses. And I'm just so grateful and blessed to have been part of this this positive thing that we did. And I always had something in me that made me want to go out and do things in the community, because in return I get this happy, lovely feeling in my heart. And I've always wanted to go to Africa and Haiti and do it. So again, thanks for the opportunity. And this experience has really just added more fuel to that burning desire. So I am pumped. I am more ready than I was before to just continue making it happen.
Thank you very much. It's very dedicated for the mission. I mean, it was very, very much appreciated. You jump in and do the babies, not only the NICU, but remember for the schools also, like singing, dancing with the kids. I mean, it was a very good experience, at least to see you flourish on your upcoming rising nurse. So thank you for doing whatever you did.
Thank you.
Yeah.
And singing.
And sing, I know. Yes. Yes, more videos are coming for that. Yes.
Yeah, it was a good time.
That's good.
Thank
Mrs. K, hosted, do you want to say something? Mrs. K was one of the volunteers from your pilot medical mission when we were in 2019, and she did contribute for this medical mission, and thank you for your contribution. Do you want to say anything you want to share?
I was just amazed and so blessed to see how many that you got for this mission and how things have advanced some since our last one, because I mean, it was such a different experience for me because I'm 75 years old and the Lord just laid on my heart for that first mission. He said, go. And I have never been on a mission trip. I have never done anything like this before. I've given to missions. I've done, as far as through our church and everything. But when it was mentioned in our church, God just said, go. And I didn't question that. I just went on faith. I didn't have the money. I didn't think I had the resources. I was wondering about my age, and God just put everything together. And one of my biggest gifts is prayer. So most of the time that a lot of time was spent in prayer prior to and during, but also I use some of my administrative skills that I've had to record a lot of the what Dr. Mukala Kadei did when she saw her patients. I did all that recording and so forth. But anyways, it was a trip that changed my life, and I will never be the same because of it. I see the faces of those children at the school and how excited they were just to get a toothbrush. Exactly. I mean, a toothbrush. And it made me just appreciate all the more, that I have in this country and all the blessings that I have. I mean, I am truly blessed. If I get a headache, I can run down to CVS and get aspirin. They can't do that. I mean, I just can't explain to you. It was a very it changed my life, and it changed my, you know, my goal of what can I do to help? I mean, a little bit of money, but I pray, and our church continues to support Dr. Gabon. So I think I've talked enough, but anyways, it was truly a blessing.
No, I mean, you were blessing for the pilot mission 2019, and you mentioned about the prayers. That was so much needed. You prayed for us for breakfast, for lunch, for dinner, for before going to sleep, before any traveling. I mean, it was a blessing 2019. And as I said before, for Mr. Steve, for this mission, and for you, for the previous mission, definitely those blessings carried us and saved us from a lot of things that could have happened but didn't, because God wanted us to complete what he wants us to do in Tanzania. So thank you very much, Mrs. K. And on top of that, remember I said when to join the medical mission, you do not have to be a healthcare worker. I mean, if you're a healthcare worker, great, and thank you. But if you're not, as long as you're dedicated and you want to go and contribute, and Mrs. K saying, God asked her, and she said yes. So when you feel like you can dedicate your time, please join us. We will find something for you to do. What like Mrs. K was saying, she was documenting, you know, like itemized things that Dr. Anne-Marie Cadet was seeing patients, outpatients. Then she just jotted down, okay, this time, I mean, the age of the patient, this is diagnosis, and as well, I mean, it's HIPAA, we're not sharing that information with anybody else. We want that statistic, so we know next time when we are recruiting people, let's say if the diabetic is the priority in Tanzania on that area that we are going in, I need to get people who have experience or expertise on those areas, so we can come and address that issue. So that information is only used for us to be able to recruit the right people, right expertise, and so we can come and answer those kids. For example, right now, we have Dr. Robert from NICU there helping us to tell us what area that is needed, education-wise or training-wise. And then, of course, we saw on our own. So now, if I'm here working to recruit for 2022, I'm talking to those people who have neonatal experiences, working with nurses and doctors, training, education, and people who want to donate on those areas. So those are the ones I'm speaking with you right now, specifically for the those babies and the NICU. So the same thing, even if you are not a healthcare worker, but you can donate money, please, that would be perfect. And we can use anybody who's dedicated enough to wants to help other people. So thank you, Mrs. K, for your contribution and your ongoing support for the QHSC, because without you and everybody else, we cannot. As I said, from the donation part, we had 98% supporting this medical mission is individual donors, people who are getting those $5 up to $1,000 of their own money to support us, what we are doing. So thank you, and thank you, and thank you again. Miss Nancy, are you there?
How are you?
Hey, I'm good. How are you?
Great. I just want to say how incredibly proud I am of all of you for making such a difference for everyone that you supported in Tanzania. My goal for next year would be I would like to collaborate with whomever to develop educational materials for the pregnant woman with diabetes, and then also the non-pregnant person with diabetes. So however we can collaborate, I am willing to put the hours in.
Ms. Nancy Littner was one of the global participants on the virtual conference that was done on the 17th of September while we were in the medical mission. They were discussing about the gestational diabetes. What can we do to identify, manage, and then treat the patients who have diabetes during the pregnancy? How can we minimize trauma or birth trauma for this child or the moms, and how can we prevent postpartum hemorrhage? Because bigger babies, chances is things happen and then the mom may end up bleeding more than necessary. So Miss Nancy was one of the global volunteer, and she created a PowerPoint, which is going to be linked once we finish all this. It's going to be linked in with the virtual discussion, and then of course we're going to start trying to work on those protocols We did do like an informal survey, which I was going to give more information later, but we focused on the area for the gestational diabetes, because we need to identify those moms who are at risk and help them manage it before they get to that delivery day. And then once we do that, then we can protect and help those kids that they will go to Dr. Roberts' NICU to make sure that they are healthy, they can stay with mom, not going to the NICU, and at least go home with mom when mom is going home. So, I mean, there's a lot of work to do. And Miss Nancy, yes, you are going to be needed. And I already signed you up, I'm sorry. You're going to be needed.
I did have a conversation, a long conversation with the lead diabetes educator, and his biggest goal is to empower the nurses, because the nurses feel bad because they don't have the knowledge they need to have an impact on the patient. So I told him that I'd be happy to work with him, share any tools or documents, you know, and then try to format it to know how they provide the care in Tanzania.
Yes, no, definitely. That's why the protocol comes in, because right now it's hard, either for the nurses or for the doctors, it's hard to be able to know or to have a consistent care between one hospital to one, or one physician to one to the next, or one hospital to the next. So that's the part that you're coming in. We are trying to identify those areas and then try to make a protocol that fits the Tanzanian practice, and then be able to help those pregnant women. And of course, you did mention that even people who are not pregnant, yes, even for any adults who is require those protocols, then definitely we're going to work on that part. But that is a big thing. I don't know if you were on the line when I had future activities. 2 hospitals already requested about the diabetes, gestational diabetes training and protocols. So that is already on the works. And yeah, just keep your phone line open.
Oh, I will. I'll keep it on the bedside table.
Yes, good. I have you on my speed dial.
Okay, I'm here. I am here, and you know, John and I are praying every day that we can make it to Tanzania next fall.
Yes, we'll keep praying and ask the good Lord to bless us and make that decision, and then we can go and help His people. So, yes, we're gonna do that.
Yes.
Miss Kim, hi.
Hi, how are you?
Good.
Yeah. Thank you for the wonderful presentation you have been given to us, the good highlights you have been given to us. Thank you, QHC, for volunteer to come to help our people here in Tanzania. It was very grateful. Through you, we learn a lot how to volunteer. So at least it's not part you giving us the donation and training, you even teach us about how to volunteer in Tanzania. Thank you so much about that. So my just suggestion, maybe I was thinking maybe for next year, we have been concentrating about only in Dar es Salaam. But I just believing here in Tanzania, we have another local area where we need most. So I don't know what can we do about it.
Oh no, so whoever was on the presentation, it was places that we are thinking, we are still collaborating. I mean, it's not finalized. By the end of the year, that's when we'll finalize. Because right now, it's hard to make that decision where we are going, because it all depends, one, logistic. How many people they're going to allow, how much education do they need, how much education they're willing to allow, give us more time. And, you know, like a logistical, like invitation part. And then how many people expertise-wise. And then how can we sustain after we finish that part? So there's a lot of things that need to be going on. So if there's any suggestion like what you're just mentioning right now in the local area, going to the local area, that's what is needed, because those are the ones that need the most. They don't have that resource. They don't have that expert who goes to their village to go and help them. I mean, so those are the things that we can definitely include in there, as long as we, first of all, we get permission. Because remember, when we're going to this vulnerable population, we do need to get the permission, and we want to make sure we get the clearance so we can reach and try to help them or support or facilitate whatever they have to make it better for themselves. So definitely we need more logistic stuff done behind the scene. By the end of the year, definitely we identify the areas that we can go and focus. we don't want to stretch ourselves so thin. We don't want to say we're going to go for 5 areas or 7 areas. So the problem is whatever we raise is going to be distributed for 5 areas. So that is not going to be enough, but we don't want to limit ourselves. So if the good Lord give us the blessing and the opportunity, we select maybe 2 or 3 areas so we can be the most impactful. We can help as much, and those are the ones that we need to do. But yeah, we are still in negotiation, and we're still working on those. Going to the local area is at most great experience, definitely.
Okay, thank you so much.
Habari gani?
Salama, mambo.
Boa. I wanted to add, I'm not sure how this would work out, but I would say when we were working with the magnet, I think that our actual manpower, because I know we had calculations for that, I would say it kind of doubled on that day. Jessica is a integral part of the QHSC Tanzanian component, and we were very uniform together. Everybody was working together. So I would say that our actual manpower in terms of the calculations, I would say it almost doubled. I'm not sure how many people she had there on that day, but that's just something to consider in the future.
Yeah, so we have 100 kids, and we had 50, I believe, coaches and parents totaling 50. That's what I itemized that day. I'm not sure if that was the final tallies from a magnet standpoint. And I do agree, for our volunteers, all of us, 15 of them, and at one place at one time providing that care. But that's why we were able to manage that 150 people. And yes, so people who are not necessarily healthcare related individuals, they can be useful or they used the most on those areas when you're doing the community outreach activities. Because the community outreach activity, you may need fewer expertise, but you need for the area, you might need more supporting individuals. So that's the part which we can use more people that way. Yeah, definitely. Right. It was like the oil machine.
Yes, yeah. And so what I was saying is, so that let's say we had 15 volunteers there. I know Jessica, I think, had 2 cameramen. There were several other volunteers as well. I don't know if they were coaches as well or parents as well, but it was we had 2 teams of volunteers there. So that's what I'm saying. We could consider that as part of the global volunteers that are working to bring about the a collaborative effort. But like I said, maybe the calculation. So if you say, okay, we had 15, maybe we could say, okay, well, in actuality, maybe we had 25. Or so helping out with the event and stuff like that. So, but that's just something that I bring up for a suggestion. Though.
No, that's fine then, because those change number will be only for the in a magnet event. So that's fine.
Sorry about that. I was struggling to get off mute. It's been wonderful to hear everyone's stories and just all about the trip and receiving the pictures and everything. And I can't wait to go next year and join you all, and just keep the pictures coming, and I can keep posting on social media. So just send them in the group chat and kind of give me a context of what was going on when the picture was taken, so I can make sure and include that. And if everyone can just send me their social media, Instagram and Twitter handles, then I can make sure that you're tagged in them and credited appropriately. So just thanks so much, everyone, for going and for sharing your stories and just contributing to this wonderful organization.
Thank you, Ms. Annie, for posting and making the QHSC more visible to the social media aspect. Yeah, so she was posting quite a bit of the pictures, and as I said, I do agree. If people send pictures to her, just add more explanation, so then we can share what really happened when that picture was going on. And as I said, there is so much media to be posted. So if we do share that information, then mentioning QHSC also does support the organization and make our organization more visible and relatable to people, because it becomes, like everybody will be aware of what we are doing. So when we're informing them what things are or activities are happening, then at least they will know what is QHSC. Thank you, Ms. Annie. Mr. George?
Yeah, I've been following the presentations, and I was so happy to see all what you have done during the very short period of time, and you have accomplished so much. And I'm looking forward maybe next time to find some time, like a day here and there to join you. You are doing a very, very good job. So thank you for for everyone who participated. Thank you for the volunteers. This is the very good job. Please keep up.
Thank you, and thank you for your help with all the logistic questions, asking when we were planning, and then so helping the organization shape what they need to do. And thanks to Mr. Gilbert, he's not on the call, but probably is at work. Also for suggesting, and Mr. Annie also, they were always shooting the questions to me and say, okay, what about this? Did you do that? Or why did you do that? So when we have all those agendas or activity list, then they always provide their feedback. So thank you very much. Ms. Kisa also usually review the information and send the information also. So thank you. And everybody, I mean, all the board members for your feedback and support of the organization. Thank you. We are going to add more people on the boards, and because people have shown some interest to join and actively participating. So that is a good news. And we do have the QHSC member group, member and friends. So people who wants to know what the QHSC is doing or what activities that we focus on now, just join that link and be able to come and be part of us. And then also you can go to the website and subscribe, be a member. You can also go to the YouTube, also subscribe and be a member. So anytime we post any education material or training, then you'll be able to see or hear and then share with the other people so that people can learn and gain from it. And we always welcome the feedback from everybody so we can improve. We are always learning. We're not perfect. So if we didn't get something right the first time, then we'll learn and make it better next time. So we are open for feedback. So please send them to Dr. Gabone QHSC@gmail.com, and then we can take it from there. Anybody has anything to add before we finish the meeting?
I was going to say that
we're dealing with NICU babies. Those are really compromised babies, and things usually are going to happen unless we intervene. So certain things, even if we intervene with other resources, you're still going to happen. Those outcomes may not be what we want. So it is very emotional every single time. So people usually who works in the NICU, we always have said they have a thick heart, meaning like they can carry as much as they can while you're helping these kids, or sometimes you don't know even that child is gonna make it. So you are really working under a lot of stress, but still you have to be there for that child and their parents. So it is very sad. And so that's why we need to jump in and be able, wherever we can, even to lighten that load for those medical staff, nurses and doctors, by giving them resources that they need or training that they need to be able to take care of these babies who are vulnerable. And at the end, save 1 to 100 or 1,000 lives of those kids. That would be the ultimate goal. So it is very sad, but that's where the healthcare part comes in. We do have to arm ourselves with the competent skills to be able to take care of these vulnerable babies. So yeah. The trip can be emotional. I mean, we had several emotions moments where individual growth is needed in a sense that you appreciate what you have and you see the drive to help others. So it's a lot of stuff that we can do, and God gave us the strength, so we are going to do it. And we're going to ask the help of all our family, friends, neighbors, co-workers, and corporate sponsors to continue helping us along so we can support and build others up. So if anybody, there's nobody have anything, again, thank you for your time. Thank you for coming to the meeting, and we are going to share this video and more future videos. You will get them, and then you start seeing when we are starting to prepare for the next medical mission. Once we itemize and identify activities that we are going to focus on, probably within a month or so, so then we'll be able to start aggressively fundraising, writing for grants, looking for help, recruiting people who are specifically are targeting for those areas that you identify, and to make sure that they're committed, and we start probably training even before we get there, just to make sure we have already established that connection with those identified areas, and so then we can do as much as we want to do for those areas, because we have very few days. 14 days is not that much, and including traveling here and there, so it's not enough. But even if we spend the 4 or 5 days, definitely that would be great for us to do. So again, thank you very much from Team QHSC. Oh, there she is. But yeah, so thank you very much, everybody, and we'll be in touch. More to come. Bye. Bye. QHSC.
Bye.
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 Bye-bye.
Bye.
Bye.
Santa Sana.
Asante, Tony.